Hello, and welcome to Community Pulse. Community Pulse is a public affairs show about public health, wellness, and life sciences in Chicago. My name is Levi Moore, and I'm one of the three rotating co-hosts of Community Pulse. And I'd like to welcome my two guests from a company that we would call a disruptor called EmVenio, Niambi Blodgett and Natasha Creal. Uh, yeah, thank you so much for appearing. I'm going to do some housekeeping stuff first, okay? Um, Community Pulse is sponsored by the Hectone Institute of Medicine. It's an 80-year-old not-for-profit institution that has been engaged in numerous public health programs over the years. I work for Hectone. Part of my duties is to coordinate the activities of a 15 organization coalition of public health groups. And so it's called the Foxglove Alliance. And the Foxglove Alliance puts on this show in partnership with Hectone's Nurses and the Humanities program, which is also the Chicago chapter of the American Society of Surgical Nurses, and the Healthcare Council of Chicago. So with all of that, now we can get to the good part. So first, before we get into EmVenio and everything, Niambi, Natasha, can you just tell us about yourself.
Sure, absolutely. I'll go first. My name is Niambi Blodgett, and at EmVenio, I serve as the Director of Global Patient Engagement. That gives me the amazing honor of supporting our community partnerships, the ways in which we engage with the local population to educate them with reference to clinical research, and also with reference to studies that we have available. So I strategize our methods for recruiting for studies. Previously, I worked as a project manager for Matrix clinical trials, and I did that with the effort of study startup as well as feasibility. And then I had the honor and pleasure of also implementing a DEI and A council within Matrix clinical trials as well. As you know, we are simply committed as an organization to making positive impacts. And so I take that approach both in my personal life as well as in my career, my professional life. And so volunteer some time to help bring an end to human trafficking as well. So I've brought Natasha with me today because she's absolutely amazing in our local representation there in Chicago. And so I'm going to turn it to Natasha now to just share a little bit about herself as well.
Thank you. My name is Natasha Creal. I'm also one of the employees with EmVenio Research. I currently am I'm a mobile unit operator. I operate one of the 40-foot RVs that we have on site in our Illinois Medical District. We are actually right across the street from the Cook County Hospital and right adjacent to the VA hospital. I do help with I'm actually a medical assistant as well. So I do help with the patient participants with intake, with doing vitals, labs, EKGs, any blood draws that may need to be done. I have a large medical background where I've done some traveling assignments. I've actually worked in research, and I finished a 30-year research study with Northwestern back in 2022. And yeah, I've got my foot on the ground recently with some CDL driving. So I kind of have a little bit of background with quite a few things going on right now.
Thank you. Well, and let me kind of frame this for our viewers. The reason why this is so important is because this area is one of the priorities for the Foxglove Alliance last year and this year. Let's go back, and I'm not sure how many of you do, but think about your last meeting before the pandemic forced us, most of us who weren't essential, to stay at home. Well, mine was with one of the Foxglove founders, Dr. Dennis Levinson. And Dr. Levinson, his real job is his team. They were developing, working on a vaccine for the COVID through AstraZeneca. And when I went there, his team, they were literally pulling their hair out of their heads. And I was like, okay, what? Said they did not have enough African American or Mexican American people of Mexican American descent people in their trial. And so I was like, and why is that such a big problem? Because they just said bluntly that it may not be as effective on Black people and brown people. Yeah. And I thought, wow, it's been an issue for a long time, and figured, you know what, the Fox Love Alliance 15 members, we're kind of set up to try to do something about this. So it's called M3R, More Minorities in Medical Research. And there's another goal, but the main thing is in Chicago to try to get more Black and brown people to participate in clinical trials. And just on a personal note, part of the reason why I'm here, I participated in a clinical trial through the University of Chicago, and it was really it was pretty much a lifesaver. So it's professional and very personal to me. So with that set up, okay, tell us about just EmVenio. I called it a disruptor, and meaning folks like remember how Netflix was a disruptor, how Uber was a disruptor, how Amazon was a disruptor. And when I heard about what you were doing, it's like, oh wow, you are changing the game in terms of clinical trials.
Yeah, I'll talk about that. So you said you were set up to do something about it. We're set up to do something about it too. So EmVenio is we're sites, right? We conduct clinical research. We have multiple sites across the United States and some across the United Kingdom. What makes us unique in this space is that we have an opportunity to bring clinical research to locations that often, one, don't get invited to participate. The brick and mortar sites are too far away. So we come into areas and populations that don't often have the access to clinical trial and research. We do that through our mobile clinics. So you heard Natasha talking about how she operates that for us there in Chicago. We are set up in such a way that we're able to, one, identify the best locations to go to. And we do that with the utmost care and research. I know because I'm part of that process, but we're able to take a look at the population that we're trying to focus on or trying to engage. We take a look at prevalence to see which populations it might be that holds the prevalence. We know, for example, for minorities, there are quite a few diseases that sit within minority populations, right? We're talking about cancer and obesity, diabetes, you go on and on, stroke, asthma, HIV, AIDS. And we're looking at all those components to determine where to establish our sites. Where are we putting our sites is going to allow us to engage with this particular group of people who are impacted most by prevalence, right? We're taking a look at social determinants of health as we're setting up this infrastructure and where we're going so that we can understand who we're speaking to. What are the needs in these areas that might help us better communicate, not just in a way that's valuable to us, but in a way that's also valuable to the people and the geographies that we're serving. And so we're able to do that, like I said, with the utmost care. It also allows us to decide and to look at who we're partnering with in order to broaden our message. So like you, Levi, for example, we're in the IMD, we're able to just broaden our message through different partnerships that we're able to establish, both with organizations and within the community, which gives us a unique aspect to how we approach clinical research. We do that with the care to understand the people, and that helps us continue to learn because needs are always changing, and we can design our approach to help support three things that mostly impact barriers to clinical research. One being knowledge, the other being trust, and ease of participation. So when we're locally situated, the opportunity for people to come to us in a way that decreases their their drive, decreases their time. We're able to provide a wraparound that's virtual visits, home visits. We're mobile, so we can get to different locations should we need to. Those components help us identify better opportunities to bring in underrepresented populations and those that sit in different racial and ethnic groups that often are underrepresented in studies. And so that's the unique aspect that we bring to the table. We know that, for example, most trials have been conducted on people who are largely of European ancestry. And we know that you can't simply take data and apply it to all populations. It does not work that way when you're considering the safety and effectiveness of treatment options. So we're super excited.
I know in the Black community, there's just been, and well-founded too, there's been an awful lot of mistrust. Yeah. And the thought of being guinea pigs. And, we bring back Tuskegee again. And so to try to break down those barriers has to be hard. But I know that when I started looking with the M3R, it was like, boy, this has been going on for a really, really long time. And just to change it, to change the narrative, even though that there was federal legislation that was set up to make sure that there wasn't going to be another Tuskegee. With M3R, that's some information we're trying to get out. But you mentioned how, what the mobile unit, I just thought that was fascinating. And, can you go more into that? Like, what is on there? How do you do it? Yeah.
Yeah, I'll let Natasha speak. Yeah.
Sure. So it is actually the one that I am actually operating is a 40-foot RV. It was actually turned into where we have an actual, we have 2 exam rooms on site. So we're able to do everything. We have a small lab on site. We're able to do everything from as if you would just go to your regular doctor's office, but it's mobile. We're sitting in an empty parking spot. It's run off of 2 generators. So we kind of go back and forth where we're running one generator maybe for the 8 hours that we're there on one day and switching over to the next. It's not kept there after hours. We actually put it in a storage facility where it's plugged in. And that way we're able to keep if we have any drugs on site, we're able to keep those contained to where they're temperature safe and safeguarded, things like that. But yeah, it's an actual mobile, your doctor's office coming to you. We have actually 2 nurse practitioners that are on site as well as myself. So we're able to get the job done. And with, like you said, with COVID coming in, that it's more convenient to have someone to be able to either come to you or, you can come out of your home and maybe not have to go too far. And it's kind of a one-stop shop.
Well, on a day like this, when the day we're shooting, it's like 16 degrees outside. So the thought of that travel is huge. What other cities have you, and why did you pick Chicago? Because I think you guys came into Chicago was in the last spring, right?
Yes, yeah. As of March of 2023. Yeah, we've been in Chicago. We have a unit in Florida. I'm actually currently kind of looking for a site in Georgia. We're in Arkansas, and I believe we even have something going on in the UK, as Niambi said. So
yeah, we've got sites all over in the United States. So we are in Arizona, for example, Oklahoma, to add to the ones that Natasha was speaking to. We are situated in Texas. Here in my location, Orlando, Florida, just right around the corner from me. So I pop on and off at that location as well. But we chose the locations that we did to include Chicago. Chicago is unique and it's set up, particularly the IMD. And so we have established that relationship as a result of, again, the makeup of the local area, the relationships that we've been able to establish. The IMD has been extremely welcoming. We previously worked with the University of Chicago. And so it's meets all of the opportunities for people that we're attempting to support and help and educate with reference to clinical research. While we are in the IMD, we make connections outside of that area because obviously it's really strong from a medical standpoint. So getting outside of the IMD to partner with different churches, some of the stuff we're working on now, in order to come and facilitate just a kind of get to know you on both sides, health screenings, which we're facilitating too, just to help us build the relationship part. I think you said it right, Levi, like this is the long game. It takes time to develop these relationships and trust, and that doesn't happen overnight, even though sometimes we want it to. It's like slow rolling. And so we've had an opportunity to get started right out the gate and have built amazing connections across the nation to support what we've seen. And what we have seen is in our studies, we have our diversity metric is sitting at 46%, obviously higher than industry standards as a result of the model we've created.
That's way higher.
Yeah. Yeah.
Hey, now, are you conducting the studies for yourself, or do you work with a hospital, or do you work with a pharmaceutical company, or all the above?
Yeah, we work with sponsors as well as CROs for studies. So we have worked with universities mostly through them as well, but we've worked with all of the above, and we're sites, right? So we're an opportunity to get legs into areas that maybe our clients don't have sites in those particular locations. We find that's often the value that we can bring is that there are no brick and mortars or very limited in the areas and space that we're able to access, which gives a great opportunity to all of us, to be honest.
Yeah, because there are, well, out of curiosity, do you have any active studies now in Chicago, or what's coming down the chute later this year?
Yeah, so we are in between studies right now in Chicago, but we just wrapped up our second COVID vaccine study that's there in Chicago, but I'll let Natasha speak to some of the details with reference to studies coming at her site.
Yeah, so we did just finish up with the chronic kidney disease study, which we were looking for participants with specific gene kidney disease. And then we also just had the COVID naive vaccine. That one just closed out, where we were also seeing participants to receive a non-mRNA COVID vaccine. And then currently we are gearing up for our testosterone study, which is going to include the male population ages 18 through 65. And it'll be like an oral treatment regimen, roughly for about 13 months on that study duration. And then we're not limited to any specific study right now. We're doing varieties of studies and at all of our locations, and we hope that there will be more participants engaging in whatever we're offering.
Okay. Let's say you have a study coming, you're doing in Chicago. How would people find out about it? How would they sign up? How could Foxglove help?
Yeah. So I know that we shared some details with reference to how to reach us, but we are at the 2023 West Ogden Avenue location. It's right there, and Natasha, you can probably add some more details, but it's right there across the street from the Cook County Hospital near the VA. The old Easter Seal building is where we're located, but they can reach out to us either on site, and they're welcome to give our office a call there on site. So with the team at 312-754-1891. We are offering, so Levi, we enjoy working with you. In between our studies, we're always facilitating community initiatives, right? And so we are conducting free health screenings in all of.
Yeah, the health screening studies.
Yeah, it's just a health screening, free health screening to the community. We do that free of cost, and we're able to provide the results. Natasha can speak a little more to the details that goes into that test, but it gives us a chance to invite people to learn more about clinical research in general. It gives us a chance to meet more people to speak to in the future for when these studies come, to see if they're interested and available to participate.
Yeah, so with those free health screenings, we are offering free vitals, a brief memory and eye exam, and it also includes labs, which would include your A1C, your CMP, and your CBC. And this is just a way to give back to the communities and get more involved and just to build trust and educate. And that also places the participant in our database to where we can reach out and have a way to contact them when we do have up and coming new trial studies going on.
Okay. Or community events, yeah.
Okay, and I know we can't see it, but can, in the studio, can you put up that graphic?
The graphic?
Yeah. I think the technical people need to do that. The studio, yeah.
So one of the things I would say, Levi, as to how you could help, you have been helping already. You've been helping already, and any broader opportunity that we can establish to reach out or have organizations reach out to us if they're interested in us coming to them to facilitate free health screenings on site, local churches or community centers or just organizations that might have a community that this would benefit. We're happy to make that happen. So through the contact that I shared, we can facilitate that.
Okay, will do. And I just wanted to reemphasize, okay, Chicago is a very special place in terms of medical innovation.
Yes.
There are so many clinical trials being conducted in the city of Chicago. And Chicago was also, thanks to 1871 and Matter, we're a medtech innovation hub globally. And over the next 3 to 4 years, we're going to see that. Also, there's been a very concerted effort to deal with issues related to the social determinants of health.
Yes.
Companies like yours, things that other FOX Club members are doing, like Westside United, Illinois Medical District, we're actually taking all of this very seriously now. So, please follow Community Pulse. We'll help get in contact with EmVenio, and I think I need to start wrapping this up. So, Niambi, Natasha, thank you so much for appearing on this episode. And Community Pulse, we tend to have 2 new shows that air each month. We just did our first show, which is like what we're going to do this year, and you are like my first outside guest for the year. And it's available on CAN TV, but then also on our YouTube channel, which I push out on social media, and it will be available for you guys too. So with that, I want to thank the crew at CAN TV. You've been fantastic helping us get through how to do this when it's freezing. So with that, I'm going to, unless you guys have anything else you want to mention, but thank you very much, and everybody stay warm out there.
Thank you for having us.
Thank you for having us.